I'm Katharine Allen from Interpret America, and this is InterpreTIPS, where we answer your questions about the interpreting profession. We recently received a question from an interpreter and an interpreter trainer in the Midwest who asked, during simultaneous interpreting, what should the community interpreter do when he or she runs into a term they're unfamiliar with? Now, this is an excellent question. We really don't have established best practices or any kind of formalized protocols for how to handle this situation when using simultaneous in community settings. We know what to do if we're using consecutive. We know that we need to ask for a pause and ask for clarification and then go ahead and interpret the explanation. First, to answer this question, we need to identify when are the most common situations when we would use simultaneous in community settings. I want to focus on three. The first one is when we are interpreting normally in a consecutive session for an appointment, some kind of session, and the service provider or the service user gets into a side conversation. And in this case, we are going to lean over and do a whispered simultaneous to capture what's being said. Similarly, when we're in a meeting, when we're still using largely consecutive, there may be multiple service providers or multiple service users or family members. We may go into a whispered simultaneous to capture a report or a side conversation or a longer discussion for the person we're interpreting for. And then a third, actually quite common situation in community settings is more what you do in conference interpreting. You're interpreting for a presentation, some kind of community event, a medical class. You're using simultaneous. Hopefully you have portable equipment and you're only using simultaneous, and the speaker is not expecting to be interrupted. So let's look at some strategies for these three situations. For the first two, honestly, I think you can use the technique you're using in consecutive. You may not do it the very first time or the very moment that you hear the term that you don't know, but you can wait for a natural break and pause, ask for that clarification, and then go back into the interpreting. In this setting, you're already using consecutive. They're already used to you managing the flow and asking for those pauses. And so it's important that you feel like you can do it, even though it's going to feel a little more intrusive. Now, for the third situation where you're interpreting simultaneously for a presenter, this is when you can start using the techniques that conference interpreters use. Now, the first and best technique is that you have a partner. I know this is far less common in community interpreting than in conference interpreting, but that is the best standard, best practice. So if you have a partner, they should be tracking the interpreting and they can write down the translation of the term that you're having difficulty with, and you just go ahead and insert it in when you can. Another strategy is to just wait a little bit and see if the speaker repeats the term. Often presenters will repeat their main points more than one time in a teaching presentation, and so you can grab the context of what you're listening and you may understand it, and you'll be able to provide at least a synonym or an explanatory phrase, and you can keep moving forward. Now, if neither of those work, you can go to last resort strategies. And this is really where you insert yourself directly into the communication with your audience, and you would say, the interpreter does not know the medical term just used. The interpreter is unfamiliar with the service just described. Could an audience member ask for a repetition or an explanation? Now, this is highly intrusive. It's not what we want to be doing often, but it is a valid strategy, especially if the term is critical for the service that's being given or the communication that's happening. So I hope these strategies and tips have helped you. Remember, the most important thing is that you are trying to maintain accuracy, and even if it feels intrusive and awkward, you need to get some kind of explanation so that you can capture that meaning. So don't be afraid. Do what you need to do your job well as an interpreter. That's it for now. We'll see you for the next InterpreTIPS.
If you enjoyed the video, please consider giving it a like and subscribing to our YouTube channel. For more information, visit us online at cultureandlanguage.net.